For the next lecture, I am excited to call upon Dr. Shamini Subramaniam. She is a fellow in pediatric palliative medicine. She previously graduated from Crimea State Medical University and completed her master's in medicine for pediatrics from University of Science Malaysia, USM. She has worked as a pediatrician in Hospital Teluk Intan before joining the subspecialty training for pediatric palliative care. Today, she will be giving us a lecture on spiritual care for children. Please welcome Dr. Shami.
Hi, this is Shamini. I would like to thank the organizing committee for giving me this opportunity to present on spiritual care for children. So spiritual is one of the four components of total pain as described by Cicely Saunders long before. It is an intrinsic aspect of palliative care. Spirituality refers to how an individual actually seeks his existence, his meaning of life, and expresses the meaning of his life and his purpose of his life in the way that they experience the connectedness to the moment, to the surroundings, to himself, to others, and to the nature. I would like to signify spirituality with this image. It is a beautiful scenery. It has so many elements in it. It has sea, it has the hills, it has fog, and also sometimes spirituality is like an element that we may see, or rather sometimes we may not be able to see the spiritual suffering of the children. So I would signify this sinking boat as those moments when we were unable to appreciate the spiritual suffering of the children. So some of the children, especially adolescents, they usually have this cloud of thinking within them. They are unable to express it. And from what we have gathered from each encounter, they have many questions around them, asking the meaning of their suffering, to why they are the ones who are suffering, why are things different for them as compared to their friends, what is actually happening to them. They may not understand the changes that is happening to them. They are seeking out for help. They want to be heard, but there's no one who could actually understand them. They may want to express something that is significant in managing their own health condition, but they also fear that they are not being heard or their issues are not being addressed. They also frequently ask the question if they are dying when they realize, but this question has been ignored and no adult wants to explain it to them. And they seek for help, and most of the time they seek help from their creator, which is God. So I would like to share a little story from a child that from an adolescent recently. She's a 12-year-old girl, second child out of 3 siblings, whose parents are both teachers. She is a bright student. Unfortunately, she has been diagnosed lately with vaginal Ewing sarcoma and with lung metastasis. She also has renal tubulopathy caused by chemotherapy complication. She has a painful anal fissure, constipation, and logistic issues as she need to travel 1.5 hours away to seek for her medical treatment and chemotherapy. So the challenges that she faced, she actually experienced total pain. Physically, she has experienced changes in her body image. She became more cachexic. She felt she looked more darker. She expressed pain in the anus especially when she needs to PU or BO. She had pallor. Emotionally, she suffered sadness. She was scared. She had anger, but she could not express it. And she always anticipated pain whenever she needs to PU or BO. And she was mostly lonely. Her social aspect, she was unable to attend school and take school exams like her other friends. Indirectly, she started losing friends, and there were frequent separation with her father and siblings as she had to undergo prolonged hospitalization in a different district. Spiritually, she always asked the question, why her? Kenapa saya? So the challenges that we had with her, she's an adolescent who chooses who she wants to speak to. Most of the time, she's withdrawn. She chooses the doctors and nurses that she is comfortable with. And she always wanted to express her opinion, wanted to be heard. And she refused the multiple examinations, especially on her private part. And she desired to go back to school and attend school regularly and sit for the school exams. So as she was very withdrawn and she refused to be examined, she refused to express the nature of her pain, the intensity of pain, and even the localization of the pain. And she was not really cooperative during examinations as well. So we had to figure out a way to be friends with her so that she will open up and also to cooperate with medical therapy. So we tried to use this button game to facilitate communication. After a few visits, and we made appointment with her. And after office hours, when the wards were more quiet, less busier, we went to approach her, and we showed her this display of various buttons of different characters, colors, sizes, shapes with cartoon images, which indirectly attracted her to want to play, and she wanted to touch each button and say something about it. So the first word that she said was "Chomelnya." So then she slowly opened up. So I went on to ask her, can you describe uh your younger days with one of the buttons here? So she actually picked up the blue monkey button, and then she already started to laugh and giggle. So we went on to ask her, would you like to share with us why are you giggling by yourself? And then she opened up to say that it reminded her of her happy younger days when they went on a family trip. And she remembered that the monkey in the zoo was attacking her mom, and the mom had to run by throwing the food all over. And it really broke the ice at that moment because the mom burst into laughter as well. And we were able to speak further with her. And then she went on to pick the Doraemon, and she described why Doraemon was because it reminded her of those days that when she was healthy and she had time at home, and she felt happy watching Doraemon. And she also learned some moral value from Doraemon, and she learned that we should not be proud, and she loves to actually have someone to help her, like how Doraemon helped Nobita. And then she went on to pick the baby stroller and the ice cream. And then she described that she misses her younger sister, and ice cream signified that she loved eating food whenever she's healthy, and she loved eating ice cream with her sister. And she went on to pick Superman and Upin. So I asked her, why did you pick these two characters? And then she quickly answered that Superman looks like her father. She feels her father is a Superman, but at the same time, she was attracted to the face of this Superman, that angry looking funny face, and Upin. So it reminded her that her father always cracked jokes and makes funny faces at home that kept her cheerful and happy. And then when we asked her what are her hopes for the family, she actually picked up a squirrel hugging a heart. And she said that she really, really sayang her father and wants him to be always around. And the red heart is because she sayang the whole family and she actually wants the whole family to be united once again. And we told her to pick a button that um, signifies the person that makes her happy, if there's any one person. But she picked up 3 buttons here. So she picked up the purple lip, which signified her mom's favorite color, purple. And then she picked up the blue car because she said she was very happy whenever they can travel together as a family in her father's car. And she also was reminded that the father will always tegur them to keep the car clean. And then she picked the Batman to signify her elder brother, and she looks at her elder brother as a superhero who always tries to help her no matter what. And went on to ask her if there's any button to signify her desire or her hopes for the future. So she was very quick to pick up this button of a cute little girl with a cute ribbon, and she says that she wants her mom to look as happy as this little girl. And she picked up a camera and she says that she wants to take more photos, as previously she loves to do TikTok videos when she's healthy, and she loves to take selfies as well. And she also expressed her desire is actually to have a kitten as a pet. And she quickly turned to her mom to ask for permission. And she said she desired to have a pet in a long time and waiting for her mom's approval. And after this session, she felt excited. She was smiling. So I went on to ask her to write down what she felt. So she actually wrote that she felt gembira after playing this game as she dapat luahkan perasaan. So even the mom, she wrote that through this button game that facilitated the communication between us and the daughter, actually made the mom to have some time to think about her past. Then she felt happy and menenangkan fikiran. And she also mentioned that she can menghargai masa yang ada dengan melakukan sesuatu yang baik untuk insan-insan yang tersayang, as she was reminded by her daughter. And then on that day, she went on to actually open up to say that she has pain in her private part, but she's not comfortable to allow everyone to examine it. So she said that when she's ready, she will let us examine. So I went on the second day. Sorry, this was the third day already, and she was a bit more silent because she was having pain at that point, and I saw that she was reading a book, and this chapter actually is about ingin melihat pelangi, tempuhlah hujan terlebih dahulu. So she was we did not understand why she picked this book. She bought this book online, but after a while she said that she felt nobody actually wants to talk to her on the things that she wants to hear, and she felt that nobody actually wants to hear her say the things that she wants to say. So she was looking for books for inspiration and motivation, and she felt that this book had something to speak to her. So slowly after that, I was able to explore further. And she actually said her total pain in terms of spiritual, she questioned why her sickness has to involve her private part. And she felt there was loss of a purpose. She felt, why her when she's actually a bright student? Why is she the one who is sick? Why is she always sick? Why she can't even take her exams as her friends? Why she can't bake cookies and make TikTok videos? And she felt lonely. She felt like nobody wants to chat with her. She felt like nobody wants to reply her messages. There was guilt in her thoughts. She was worried about her mom, but she was unable to express it. And she wanted her mom to be happy again as before. She felt that she lost her own space because she was sick in her private part and she disliked people checking her, but she couldn't even stop them. And spiritual beliefs, she felt that her mom always prays for her. But then there was a long pause and she burst into crying and she felt like prayers were not answered. And she felt fear sometimes. And she was trying to seek for the meaning of this suffering through reading books, as she felt like she couldn't speak about it. On the other hand, her mom's spiritual suffering was she feared what's going to happen after the repeat scans. What is the next decision? She was worried if her daughter is going to be asking her questions. And she felt that she only could pray and ask for strength from God. And she always asked God to forgive her, forgive us as a family. And she always tried to look for how else can she help her daughter. So few the following day, the daughter actually wrote like to express herself instead of talking. So she gave herself through this we felt that she was actually motivating herself. She was actually she gave the title of Love Yourself. She reminded herself to terima diri sendiri apa yang ada, berhenti membandingkan kelebihan atau kebahagiaan orang lain dengan kelemahan diri sendiri. And then she assured herself, kerana kamu seindah ciptaan Tuhan. And setiap insan yang diciptakan itu punyai keistimewaan. And the mom also wrote some reflections. And so in this kind of situation, of course, even the managing team is overwhelmed by empathy and they felt sorry for the child and they are still trying their best to manage her and hoping that the scans were favorable. So how do we support? What I learned from her is try to assist regular discussion, especially as a teenager, and identify their concerns, those things that they may have some sensitive needs, and try to assist them in planning on their concern and goal of care. And try to explore their expectations, their understanding, their wishes, rather than assuming. And then, obviously, importantly, respect their cultural values, their religious values. And through this child, I learned the importance of facilitating communication. And try to build a support system for her as she was seeking out for help. She was seeking out for somebody to talk to. So from her, I learned that some days I just have to learn from the kids as they take the lead from a complex situation to breaking it into simple issues as at their own comfort. And some days they open up when they feel heard or focus is them instead of their parents. So in her case, I allowed her to be herself, and I allowed the persistence in communication, visited her regularly, and slowly learn from her body language, search for some cues, um, try to build that trust, build that rapport, listen to her more, and allow her to voice out certain decisions, and allow her to embrace her self-worth as she reflected in the poem that she wrote. So with this, I end my presentation. Thank you.
Thank you very much, Shamini. I think that's a very beautiful sharing. And I think a lot of us are moved by how much you were able to support that patient throughout the journey, as well as allowing the mother to be there in the space together with the patient. I think it's never easy to go through that period of time, or that whole situation, and the fact that you can share that with us, I think opens up a whole lot of avenue in terms of what we can do and how we can support our patients and their families, no matter if they're children, adults, or older persons, really. I mean, everyone can put in their comments or questions on the message group, and then we'll bring back Dr. Shamini to the stage during the Q&A later. We'll move on to the next session very soon. Thank you, everyone.